All right, I'm going to give everyone about a minute to filter in. Hi, Renee. I see your chat. All right, we'll get started in just a moment, just letting people filter in. Hi, Andrea. It's nice to hear you. A lot of familiar faces. Well, not faces, I can't see anyone, but familiar names. We're getting people from all over the United States, maybe a few international folks too. There we go. See Germany. Excellent. Canadian. Unfortunately, I'm not going to be able to do the talk today in German or in French, but English will have to suffice. All right, let's go ahead and get started. It's 1 o'clock my time, so 2 o'clock Eastern. Today, we're going to talk about motivational approaches for supporters of individuals with hoarding disorder. From what I understand, this is a joint session between professionals as well as family members who have a loved one with hoarding in their life. To be honest, that makes this a little bit of a challenging talk because, there might be slightly different perspectives that a professional versus a loved one might come at this situation with. So there might be various points where I might emphasize points for professionals and various points where I emphasize comments and thoughts related to loved ones who have a family member with hoarding. Can everyone hear me okay? Give me a thumbs up or something in the chat. We're good on the vocals. Okay, good, thank you. Before we get started, I'd like to introduce myself. My name is Dr. Greg Chasson. I am a licensed clinical psychologist in Illinois and Maryland. I am primarily, my main job is as an associate professor and the director of clinical training for the clinical psychology PhD program at Illinois Institute of Technology in the Chicago area. I also own and operate a small practice, just a solo practice where I see individuals with OCD spectrum conditions, including hoarding disorder. So that will be the context that is the foundation of my talk today. My hope is to get through the content in an hour or less, and then open up the rest of the time, 15 minutes or more, for questions, because I know a lot of people have questions about how to approach a loved one with hoarding, or how to approach, as a professional, family members of people with hoarding. Okay, so how did I get involved in family and hoarding? I really think this is a common story for professionals who will very much appreciate what I'm about to reveal. As I was becoming more and more acquainted with hoarding in my clinical practice and in my research when I was an assistant professor at Towson University in the Baltimore area, I was getting a lot of phone calls from family members of loved ones with hoarding. It was, to be honest with you, very frustrating, because not that I don't want to help individuals, family members, but most of the time, my first question would be, oh, I understand it's very difficult to have a loved one with hoarding. Does the individual want treatment? Does the individual want to change? And the answer invariably was no, with a little bit of a laugh, because the common story was that their loved one was pretty comfortable in their lifestyle and didn't necessarily want to change. So I got really frustrated with this. I wanted to offer family members something to help their loved one with hoarding, but it was very difficult if the individual with hoarding didn't want to change. So my grad students and I got together and we started brainstorming. How can we leverage the energy and the love and support from family members to nudge their loved one with hoarding towards treatment. Well, at the same time, how can we also provide them with some coping strategies and education so that they can learn how to navigate the complexity of having a family member with hoarding disorder? And so we designed a treatment manual based theoretically on what we thought would be the most critical elements of helping family members work with their loved one with hoarding. We put together this manual, which incidentally has been revised since then. It used to be 14 sessions, and now it's 10 sessions, about an hour each, based on our first pilot study, which showed some promise. And we made some revisions based on feedback from family. And this whole package we're calling Family as Motivators Training. And that manual is available for free from me if you shoot me an email. The email is right there. It's also in the slides, which I believe are going to be available through the IOCDF, gchasson@gmail.com. I'm happy to send you that manual. I'm not looking to make money on this. I'm looking to spread the technique and give people opportunity to support their loved ones, or as a professional to implement groups or individual sessions with family members. This is such a public health burden that the more knowledge and that we can spread about techniques that can essentially nudge loved ones with hoarding towards treatment, or at least provide support for family members, to me would be a huge win. So essentially, what do we do about family members that are ambivalent about treatment? How do family members deal with a loved one who's ambivalent? That was at the core of the research question and the question that drove the creation of this Family as Motivators training. How do you help someone who doesn't necessarily want help or who doesn't see that they need help? And there really wasn't a whole lot out there at the time. But there was plenty out there on other conditions and how to involve family. And so we leveraged a lot of that information, some of it from the work of Gail Steckedy, who has been organizing this conference, and others who we will talk about in just a moment. So it was inspired by some of the work on harm reduction and family involvement from Dr. Michael Tompkins, who has been somebody that we've collaborated with and consulted with on this family work. We've done a lot of work, like I said, with looking at some of the work done by Gail Steckedy and Barbara Van Oppen on family accommodation, and we have integrated a lot of that into our manual. And we have utilized a lot of what we call motivational interviewing. It is a set of techniques for helping individuals communicate in a little bit more of an effective way that actually helps individuals respond to their loved one with hoarding in a way that helps promote or facilitate treatment seeking and non-judgment and less animosity. And we really drew heavily from the workbook and the work by Rosengren to put some of that together. So I'm in no way suggesting that this work is not derivative of other people's work. In a lot of ways, we are taking some of the main and inspirational principles and techniques from what has worked in other populations and trying them here with hoarding disorder. So again, it really came down to harnessing the power and love from family members. We were getting so many calls. Very rarely, although not zero, we would get calls from the actual individual with hoarding. Mostly it came from family members, spouses, parents, children, adult children, or even not adult children. I got a few calls from teenagers asking for help because of a parent with hoarding. It could be brothers or sisters, grandparents, you name it. And we designed this package to work across the board with just about any family member. In fact, we have a few people down in the Houston area who are contemplating adapting this for friends or even emergency responders. How can we utilize some of this for paramedics or police officers or firefighters? So I don't know that this has to be just family as motivators training. Maybe it could be friends as motivators training. So you can think about it in a little bit more of a broad context to take some of these principles. And I really honestly believe professionals can utilize a lot of these own techniques, as well as training close collaterals of individuals to implement them. So the goal, of course, is to do several things. Most of it focused, frankly, on the loved one without hoarding, but also focused on the individual with hoarding. we're not intending to bring in the individual with hoarding. As I mentioned, that is a really difficult task because oftentimes they don't want to come in. And you can't force someone to do something that they don't want unless there's some sort of legal or judge order. But even that isn't particularly useful, or there aren't really good outcomes among people who are forced to do these things. So instead, we'd like to give some tools to people around the individual with hoarding to help create an environment where seeking help for the individual with hoarding would make more sense and is facilitated. So can we increase treatment readiness and treatment seeking behavior among individuals with hoarding? And so that's targeting the individual with hoarding specifically, but without actually including them in the protocol. And then there's increasing well-being and distress among the relatives of the individual with hoarding. So can we maybe provide some education and some support, some new perspective, some tools that provide us a little bit of a release valve for helping family members who are struggling with a loved one with hoarding in their family. And then, of course, as a consequence of that, a positive consequence, we're hoping that this ultimately would reduce family tension, fighting, and overall enhance the family dynamic. Of course, I always put a caveat that every family is so unique and different. Our goal is not to look like this poster family over here on the right. It's to make an idiosyncratic family that makes sense for the family, but ultimately decreases things in negative affect, fighting, tension, and overall cooperation and positive affect. Can we do that within any given family unit, regardless of what they look like? So how does this theoretical process work? Based on the research we've done, we kind of have conceptualized family training or FAM training in this particular way. The research is still ongoing, but we get the sense that a family member without hoarding engages in FAM training. This then leads to implementation of the FAM strategies that we provide the family member, which ultimately leads to the family disrupting any sort of complacency or comfort that has been established in the family dynamic. So oftentimes by the time families get into family training or treatment, there's a lot of compromise and a lot of family accommodation, which is essentially a nicer way of saying enabling behavior, where people are just given in to their loved one with hoarding. And the idea is, can you start to disrupt that? Can we move away from that complacency and that enabling behavior and disrupt just a touch? We don't want to create massive animosity and tension, but just enough tension so that people aren't so comfortable because people aren't going to generally move. They're not gonna be nudged if they're feeling pretty comfortable and have things set up in the way that doesn't necessarily suggest that change is the next step. So what happens is when they start to disrupt this complacency and comfort level, the loved one with hoarding might actually experience a little bit of distress and might start to understand that this is not sustainable, that this complacency and this comfort level is at a cost, and that the family in general around the loved one with hoarding isn't really considering this a long-term strategy, and that there needs to be some change. So what happens is the loved one starts to get a little bit distressed, and then they start to potentially increase treatment readiness. There could also be some digging into the heels. We've seen a little bit of that, a little bit of resistance, but in general, some preliminary research on our outcomes suggests that there's also an increase in potential treatment readiness, which is, in my mind, a big victory, because getting them moving towards treatment readiness is a huge goal among a population that generally is very ambivalent about seeking treatment. So ultimately, we're hoping that there's some treatment-seeking behavior that occurs among individuals with hoarding as a result of implementing FAM. Ultimately, that is something that is outside of the control of the family member. You can do everything you want and do it correctly and do it well, and still the family member may not seek out the treatment that you hope they do. And I think part of FAM training is understanding that you only have so much control over other people. People have self-determination. That is, in general, people can choose not to get the treatment, even if that treatment makes the most sense and is clearly indicated. In fact, we're dealing with that here in the States with vaccinations. People are choosing through self-determination not to have them. Politics aside, that is a great example of self-determination, where people get to make that choice. You cannot realistically force people to do a whole lot when it comes to their medical treatment. But as a side, we are really hoping to leverage the improvement in family member well-being and family dynamics, right? That is a huge goal, and that is done directly from just participating in family intervention, as well as through the loved one potentially increasing their treatment engagement. Either way, family members getting something, tools, perspective, a chance to vent, that will help them potentially feel better and increase their well-being and family dynamics. And even more indirectly, if the loved one does seek out treatment, which is the ultimate goal, that could indirectly impact improvement in family member well-being. So the skinny on fam training is that it's about 10 sessions, 60 minutes each. Used to be 14 sessions before we trimmed it down. It's manualized. Again, the manual is available upon request. It was designed as a one-to-one training with a session with a trainer. However, there are plenty of people who have adopted this and translated it actually all around the world. I've got some people translating it in Scandinavia. One individual is translating it in Japan. And I think most people are trying to translate it into a group facilitation. We have one individual who I work with in Chicago who's doing this virtually, who, I think this could even very well be implemented in a virtual format, especially in this day and age with COVID. So it's not necessarily set in stone, but it has been researched in a one-to-one format. It has 4 modules: psychoeducation, motivational interviewing training, harm reduction, and family accommodation prevention. And we're going to break down each of these through this presentation. So just to give you a quick update, I'm not going to go into excruciating detail about the research. We have a published pilot study that we did earlier in it was 2014, I believe. And then we carried out one randomized controlled trial, which we've presented at a national conference, and we're still needing to write that up if I can ever get my act together. All of which has provided some insights into the mechanisms of this training and supported it from a research standpoint. So again, 10 sessions. The first session is geared towards psychoeducation. However, after the pilot study, we built in a 20-minute first piece of the first session because we realized our first manual of this didn't provide enough space for family members to just vent. We found that it was very hard to stick with a manual and to provide the structure that was needed, but because family members just wanted to sort of get some support and validation about the frustrations of living with an individual with hoarding. It's extremely frustrating on many levels for most individuals. And we've thought that, okay, I mean, we need to provide some space for this. This is a legit need. And it was a bit of an oversight not to have that in the original, but we corrected it. And now that first 20 minutes has really allowed for individuals to come in, tell their story, get some validation, get some normalization, right? That this is a very difficult thing for family members, that we understand that there's a need for tools, and that's very frustrating that there's not a whole lot of support out there for families. And so that first 20 minutes really is designed for that purpose. Once that 20 minutes has sort of organically reduced in need and it's time to move on, this is when we launch into psychoeducation. And we get all sorts of variability in how much people know about hoarding. You might be a spouse living with somebody with hoarding for 50 years, and you'd be surprised how much misinformation they have about hoarding versus people who are just new to the hoarding world and have really immersed themselves in the research literature and understand most components of it. So we had to tailor this for all of that variability and mainly just make sure that we can transmit the most critical elements about hoarding that are pertinent for a family member. So these are things like course and prevalence, some of the main characteristics that we see with hoarding, including difficulty discarding, tendencies to save, clutter, and reasons for saving, things like that. Insight is a very important topic to get into. Again, a lot of variability. Some individuals with hoarding are very self-aware, and other individuals are a little less knowledgeable about their own behavior. Risk factors can be something to talk about, because that can be very validating for people. Oh, I get it. So this is, I mean, part of the problem is that, and I've done some research on the stigma of hoarding, is that a lot of individuals with, the public perception, the public stigma is that individuals with hoarding are making a choice about their stuff. And right, wrong, or indifferent, that perception coincides with a lot of judgment and moral thoughts about the individual with hoarding. That why don't they just stop? Why don't they just set this aside? Why don't they just throw things away? There's something wrong with them. Da, 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 da. These are the kinds of thoughts that I think can be pretty damaging to a family as well as to the individual with hoarding. So my hope is that through education, as well as some discussion and coaching and support, we can help find a more balanced perspective of hoarding, that this is a biopsychosocial issue that has elements that are out of the individual's control, and that there are things that the individual with hoarding can in fact do, but it's not so simple as this is just a straight up choice that they're making. So it's about fighting some of that stigma. And then, of course, talking about the family and economic impact of hoarding as well can be very validating for family members, because, again, they often feel very unsupported in this situation. There are probably many family members who are in this talk right now who know exactly what I'm talking about. It can be very overwhelming to find the right types of services and to deal with a family member with hoarding who just doesn't want to get the help that they need. And, because this is born out of a cognitive behavior therapy approach in general, lots of psychoeducation handouts. We also provide a list of local resources for family members. So if you're designing this for your own use, you might need to start thinking about local resources to put together in your own handout. So after psychoeducation, which is one session, one of the first things we launch into is family accommodation. We also rearranged the order of this after the pilot study, just because we were getting a lot of people who wanted to launch into family accommodation prevention. And how do I deal with a family member would say, how do I stop getting sucked into all the enabling behavior? And so we really moved this up because it really was something that family members wanted to discuss very early on. So the first thing we did was we defined it. Family accommodation is essentially when the hoarding behavior from the individual extends outside of the individual and sucks in the people around them. And it doesn't have to be family. It can be family, of course. It can be friends. It can be teachers. It can be colleagues. It can be, you name it. People can get sucked in, and doctors, medical doctors, all sorts of people can get sucked in. And the idea is that they become extensions of the hoarding rituals and compulsions and avoidance behaviors. And it also can lead to, it can also be manifested in a lot of family, essentially modifying their routines, their personal routines, family routines. An example is that no longer does the family have Thanksgiving celebration at the individual's house or Christmas celebration because the individual's house is too cluttered and it's uncomfortable for family. Well, you as a family member have just modified your expectation and the routine and accommodated this individual's cluttered environment by saying, we no longer need to go there. That's okay. We won't go to your house anymore. Now, I'm not saying that that is bad or good. I'm just giving that as an example of an accommodation behavior. Another example of actually directly participating in encouraging safety behaviors or compulsions or other hoarding behaviors would be accepting a bunch of clutter or things that you find potentially valueless because the individual with hoarding was saving it for you. In essence, you are then reinforcing or promoting that behavior among the individual with hoarding because you have just accepted what they've saved for years to give you, or you have sort of endorse the idea that they're going to save things for you later, because they don't always end up giving it to you because often it gets put away somewhere in their home, but often it's because of the intention of giving it to you later. For example, I have people who want to save medical pamphlets because they think they might need it later. Or they might think a family member needs it later. Oh, well, if this person has heart disease, they should have this medical information. I'm going to save it for them. Well, if you have somehow gone along with this as the loved one, saying, sure, if you want to give that to me later, if I ever have heart disease, fine. Or you accept it, that would be an accommodating behavior. So what we do is talk to the family member and obtain 2 to 4 examples of things that they might engage in with their loved one with hoarding, because then that provides grist for the meal. It really gives us fodder to talk about with the family member and to use it as an example in their own life. The next thing we do is we introduce a concept called expressed emotion. Now, professionals are going to be very familiar with this concept because it's been around quite a lot, and it started in the schizophrenia and psychotic spectrum disorder research literature, but has really expanded well beyond that because the principles are fairly universal, that criticism, hostility, and emotional over-involvement among family members targeting the individual with hoarding, in this case, can be extremely problematic. It could really lead to tremendous suffering and family dysfunction, and can worsen symptoms, which is interestingly, it's kind of the paradox here, right? Criticism is probably the most commonly thought about component of expressed emotion. We see this a lot in hoarding, and this is something that we really need to target in family as motivators training. Criticism is very detrimental to the individual with hoarding, and it leads to problematic family dynamics. So part of it is, can we help individuals, family members, identify when they're being critical? Even if that criticism is geared towards helping the individual, it's usually the intention is good. But the idea is, if it's being perceived as criticism, it often is having a counter effect, a negative effect on the family dynamics. Trying to work on hostility, just outright hostility, in no way or form tends to help the situation. Again, it's very important to acknowledge that sometimes, we're all human, that these situations can be really triggering and really aggravating. The idea is not to necessarily beat people up for being hostile or critical. It's about teaching them about the process so that they can do what they can to mitigate those reactions, because in the end, those reactions are not doing anyone any good. The last one is often sort of set aside and not often talked about, but emotional over-involvement can be a real problem as well. Another word for this might be enmeshment, for example, or codependency, where there's really the individual, the loved one, and the individual, the family member without hoarding tend to be overly involved in each other's lives and overly controlled, and there's a lot of codependency. This can be a problem as well that needs to be addressed, and that can be discussed in family as motivators training and hopefully addressed in a more specific treatment protocol. So one part of family accommodation prevention, with the 2 to 4 examples that you've extracted from the participant, is to create a behavioral contract. And this is taken from some of the work done by Van Alpen and Steckity, which I talked about earlier. And I'm gonna see if I can pull up an example of this. Let me give me one moment. So this is from the FAM manual. This is Appendix J4. This is an example of a harm reduction. Oh, I'm sorry, not harm reduction. I am going to show you that later. Apologies. We'll get there. 2 different contracts, I confused them. We like our contracts in family as motivators training, not from a legal perspective, but from a behavioral perspective. So you set up a behavioral contract with family accommodation where you specify the behaviors as a family member that you want to reduce because they're enabling. And you can talk about how to broach this topic with the loved one with hoarding, because often it can be a pleasant collaborative experience, or it can be a really difficult, heated conversation. And I think the former is obviously much more productive. So how can we learn some strategies for talking with our loved one with hoarding and setting up some boundaries via behavioral contract? This could be things like, well, I've been paying $40 a month for you to have an extra storage unit. I'm not going to be doing that, but I'm going to give you another 6 months so that we can plan on, consolidating and doing something with the stuff inside that storage unit. And the idea being that you're not dropping this on them with no notice, that you're giving them time to work on it. And you are doing this in a collaborative way with the individual with hoarding, but you're also starting to reduce your accommodating behavior. And so that was just one example. You can negotiate that with the loved one, but there could be a variety of things that you're trying to negotiate and not do anymore. All right. So part of the Family as Motivators training is also to discuss what are called extinction bursts. This comes from decades of research in behavioral research and behavior theory and behaviorism, where anybody who's been a parent knows exactly what I'm talking about when I describe what's next, but they're basically temporary outbursts. When somebody is on the receiving end of boundary setting, they often, whether with awareness or without, tend to increase the intensity of their anger outbursts and other types of outbursts when they get faced with a boundary setting. And this is called an extinction burst. This is a lot like, I don't mean to compare individuals with hoarding to a toddler, but the best example of extinction bursts are toddlers who don't get what they want and increase and up the ante on their tantrum, and in order to get you to comply as a parent. Being a parent myself, even I would succumb to this, even though I knew exactly what was going on. I would even label it in my head, this is an extinction burst, but because I'm also human, I would often find myself giving in. So I had to learn to train myself not to give into these things. And everyone has experienced this, and adults might experience extinction bursts and up the ante on their own behavior. And the idea is to expect this when you start to set boundaries with a loved one with hoarding, and they might increase their behavior to get you to comply or to give in. And your job is to set that boundary and not give in. As we know, once you give in at the peak of the tantrum, you've essentially reinforced the likelihood that they're going to do that again in the future. So you give a child who's at the peak of their tantrum the candy that they're wanting, they've learned that they just need to escalate to that level next time in order to get that candy. So that's essentially what you're doing with an individual with hoarding. If they've escalated and they have made it to the peak of their outburst and you've given, you've just done yourself a disservice. They're going to be doing that again, likely in the future. So the job is to allow yourself to set that boundary, not give in, and over time, the extinction burst will reduce on its own. So we talk about extinction bursts with family members so that they understand and prepare for this likely increase in the behavior, in any sort of resistance behavior among the individual with hoarding. And again, we try to normalize this. This is not just people with hoarding. Everyone is prone to having extinction bursts, and we try not to vilify or paint individuals with hoarding in such a negative way, but it is important to prepare them for people fighting back a little bit, because it's natural. It's natural. We also, want to manage relatives' expectations for change. And part of this is understanding that hoarding is complicated, and it requires a lot of practice and a lot of treatment, and it's a very emotional experience for the individual with hoarding. So the goal is to manage the relative's expectation a little bit. This is not an overnight fix. We're not necessarily going to get to zero clutter. Our goal here is to be helping the individual be more functional, learn how to address some of the processes of saving and collecting and discarding. And to, as we get into harm reduction, we'll see that becomes a priority. How can we make things safe? So once we get through family accommodation training, we move on to what's called motivational interviewing training. This takes up the bulk of FAM training because it's really critical to learn some communication skills. Now, we don't expect family members to become certified motivational interviewers by the time they're done with FAM training. That's not the expectation. The expectation is that they learn a few basics about how to communicate, and more importantly, learn how not to communicate. We find that there's a lot of retraining that needs to happen, a lot of communication tendencies that really do the opposite of what they're intending, which is causing the loved one with hoarding to dig in their heels and become more resistant. Because that's naturally what any human would do when they're confronted with some of the communication styles that I've seen among family members of loved ones with hoarding. So how can we provide some better communication skills, which the family members are often eager to learn, because I think they even recognize that their communication strategies are not particularly effective. I always start with letting individuals know that, these communication skills are useful, but they're not a guarantee. Individuals with hoarding don't have to comply with you. It's not a guarantee that this will be successful, but in general, it maximizes the likelihood that they'll move forward in the way that you want them to. And it also is a way of essentially saving your relationship, because every time you engage in a critical or hostile approach with a loved one with hoarding, it often burns through really important relationship capital. And I see it happen all too often where families are just broken because of hoarding. And I'm not sure that necessarily always has to happen. So we talk about what is motivational interviewing. We talk about what it's not. So a lot of the times we talk about what are called discrepancies. The professionals in this talk have probably encountered this concept quite a bit, especially if they're familiar with motivational interviewing. But we introduce this to the family members. This idea of what can you do to highlight, to bring to the forefront the discrepancy between where the loved one with hoarding wants to be in their life and where they actually are. That is the discrepancy that you want to milk for all it's worth. Because individuals with hoarding often have a vision for what they want in their life, like we all do. And oftentimes they're not able to confidently say that they've gotten there, that vision has been has been achieved or realized, because the hoarding often gets in the way. And so the idea is, can you develop that discrepancy between where they want to be and where they are? And can you then use that discrepancy not in a not in a heavy-handed way, but in a reminder, a gentle reminder of, look, there are other things in this world that I know that you want to see, that you want to experience. And this clutter and hoarding problem is preventing that. How can we deal with that discrepancy? That discrepancy from the motivational interviewing research has been shown to be quite a powerful motivator. So much so that even some of the research I've done using virtual reality has attempted to put that into visualization through virtual reality. Can we show people what their house would look like without the clutter? And our preliminary research is showing that it makes people pretty energized to move forward, that they become more motivated. It could have been demoralizing. We found that it was the opposite. It was actually quite engaging and motivating. So can you use that discrepancy for your own good and helping your loved one with hoarding understand what this is all for? That we're not just nagging as a family member, that we want to help you achieve the vision that you have in your head for where you want to be in your life. So there are three major components of motivational interviewing that we really highlight. Three principles, so to speak, three primary principles. One is collaboration, the other is evocation, and the other is autonomy. Collaboration is essentially this idea that you're trying to minimize any power dynamic between you and the loved one with hoarding as a family member. It's more about a collaboration, a co-pilot, that you're working together, that this is something that you will co-pilot together, come up with strategies. There will be negotiation and compromise. This is not me dictating to you as some sort of a power hierarchy. That is the collaborative element of motivational interviewing. And that is a really critical subtextual component to your interaction style as a family member, because if the individual with hoarding sort of gets a whiff of the idea that you are establishing power dominance and you're leveraging your hegemony to control the individual with hoarding, they're going to do what most people do, which is dig in their heels, because that's a pretty normal reaction. So the idea is, can you get on a level playing field with them and establish a collaborative working relationship with your loved one? Number two is about evoking change talk and evoking awareness of that discrepancy we talked about. We'll talk about change talk in a moment. It's essentially any behavior or talking or comments from the loved one with hoarding that suggests that moving forward and leaning towards change is a good thing. And you want to just take any of those comments and run with it. Those are key currency when it comes to motivational interviewing, those kind of comments from your loved one. And lastly, autonomy. And we talked about this earlier. This is this general principle of self-determination. Individuals have autonomy. They get to choose whether they change or don't change. And we'll talk more about this when we get to harm reduction. But the general sense of a more palatable approach to dealing individuals with hoarding, loved ones with hoarding, is not from a values-based approach where houses shouldn't look like this is inappropriate, this is gross, this is wrong, but instead approaching it from a safety standpoint. That, look, I'm really worried that you have papers stacked up on your stove. I'm really worried that you have empty bottles which have a high burn load in your home. This is really dangerous. I'm really concerned that you don't have an egress that's big enough for you to escape if there's a fire. These are the things that focus more on harm and harm reduction and safety, and less about a values judgment. And self-determination really ultimately comes down to the fact that you have no control over your loved one, or even as a professional, no control over your patients or clients, and that ultimately it's their decision about whether they change or not. Even if there's external pressure and force from a landlord or from the law or a judge, it's really, really hard to force someone to engage in a behavior. They might just choose to deal with the consequences. So it comes down to self-determination. This person has a choice. And so you can help them flex that self-determination with the hope that through discussion of discrepancies and leveraging change talk and other things we'll talk about today, that they will make a self-determination in the right direction. That's the hope. Also like to review motivational interviewing pitfalls. This is something that many people find useful because it's very easy to slip into some pitfalls when communicating with loved ones with hoarding. One of them is to try to challenge and change all behaviors completely and all at once. Sometimes pacing is an art, but it can help individuals, family members realize that trying to change everything all at once and overnight is never a strategy that's going to work. This requires pacing and compromise and focusing on safety as a number one priority when prioritizing what to change. We also talk about the righting reflex. Sometimes the individual the loved one without hoarding wants to just correct or give advice and dictate to the loved one with hoarding. And this is something we try to avoid. Motivational interviewing is non-judgmental, it's non-directive, and it really is about Socratically having the individual explore reasons for change and reasons for staying the same. And the more that the individual without hoarding is dictating to them, directing them, advising them, the more it's actually getting them to do the opposite of what you want, which is to argue for no change. And so that is something that we try to really highlight and emphasize when training individuals to do some motivational interviewing strategies, is try to take a step back and be non-judgmental. Try not to dictate or give advice. It's instead ask questions that get them to talk about and explore discrepancies, to argue for change instead of for against change. And it takes practice. So family members really would benefit from practicing this. And it's not something that's easy to learn overnight. And, it's important to normalize that family members who are trying to learn these strategies are going to mess up on occasion. And it's okay to mess up, and you just learn from it. Again, not being too confrontational or directive, trying to avoid the high expressed emotion at all costs. Try not to take sides. If the individual gets a whiff that you're doing this, if your loved one with hoarding gets a whiff of you trying to manipulate them or trying to force the issue, they're going to dig in their heels and they're not going to feel particularly supported. In general, the best approach is to stay neutral, take a step back, don't be judgmental, don't be directive, and don't take sides. They will inevitably argue against you because that's the natural thing to do, right? So try to be neutral, try not to take sides. And absolutely, number 5 is critical, avoiding blame. The primary goal here is to establish collaborative environment for working with your loved one with hoarding. Blame does the opposite of that. It undermines any rapport that you have with your loved one. And this could even be things that are direct blame or even microaggression type blame. The best you can do, Try to take yourself out of any stigmatizing beliefs you have about hoarding. Try to avoid blaming the individual, and recognize that this is a mental health issue where the individual doesn't have sole control over the concern over their hoarding tendencies. And that can help alleviate some of this idea and some of the tendencies to blame the individual with hoarding. Lastly, premature focus trap. This is the tendency to focus too quickly and too early when they're not ready for change. So instead, you might need to do what's called reversing, where you back up a little bit on your tendency and again, start to explore reasons for change rather than focusing too quickly on the change behavior. If they're not ready for that change behavior, they're going to get really discombobulated by it. And instead, you might need to reverse and go back and focus on just let's talk about the discrepancy. Let's see if we can evoke some change talk. Let's not be judgmental. Let's be collaborative and rapport building before we start talking about the actual change behavior, because premature focus trap can lead to a lot of people disengaging from you. The loved one with hoarding might say, whoa, calm down. I didn't even say I wanted to do this yet. I'm still ambivalent, and you might lose a little traction. We introduced the stages of change, which is probably familiar to most of the professionals in this group. This is the idea that there are different mindsets that individuals with hoarding are in about whether they want to change. A lot of individuals with hoarding are in the pre-contemplation stage. This is the stage where individuals aren't even thinking about changing. There's no reason. They're comfortable, they're complacent, they're not even considering it, or they're even opposite of that. They're anti-change. We get a lot of people in that zone, especially when family members call me. That's, when I sort of hear from family members, a lot of times their loved one is in the pre-contemplation stage. Contemplation stage is sort of the next step. It's the idea that, they're a little less comfortable. They're a little bit more open to hearing about change. They're starting to think about it. Preparation stage is that they've even gone beyond that. And now they're starting to have the intention of change, maybe even preparing some things, looking into it, researching it. Action stage is the actual carrying out the change behavior. Of course, this is ideal. And this is hard to get at the outset of meeting somebody with hoarding. Sometimes you get people with hoarding who are there though, and those are the people who come in and get treatment and start to get better. But a lot of people are earlier in that stage, earlier in the stages of change. And of course, once everything is in a better place and the change behavior is executed and things are looking good, there's a maintenance stage, which is to carry out the change behavior and to keep things at bay. Now, the research suggests that these things are not as stage-like as we originally thought in the theory, that there's more of a continuum of these stages and steps. And also people bounce back and forth or skip steps or they go backwards. So I think it's not super useful to think of this in a super rigid way, but it does help you to understand the mindset of the loved one with hoarding and how to approach them. If someone's in the pre-contemplation stage, it's not particularly wise to start talking about change behavior in that particular moment. That would be a premature focus trap where they're focusing too early on change behavior because the person is not even there yet. They're not ready for it. On the other hand, if the person's in the action stage and they're getting ready to, and they're doing decluttering exercises and sorting and discarding exercises, and they're doing exposure exercises and cognitive work, it doesn't make sense to engage an entire session on change talk. Could help to do a little bit here and there. I would advise that, but you want to make sure that you're continuing that trajectory and that momentum in the action stage and having them actually engage in the behaviors. So you want to time it correctly, and that's something that can be conveyed to family members as well. Motivational interviewing is also about good listening skills, active listening. So we introduced the OARS method, which is open-ended questions, affirmations, reflective listening, and summary statements. Now, the professionals in here are going to recognize that as the classic ways of active listening with patients and clients, ways of encouraging talk rather than encouraging people to be quiet. Open-ended questions do that. If you ask questions that are close-ended, it leads to one-word answers, and often there's not opportunity for facilitating further discussion or elaboration. Open-ended questions really are the most effective way for getting more information out of individuals. So we teach family members how to use open-ended questions in lieu of closed-ended questions, or at least increase the rate of open-ended questions. And by doing so, it helps to facilitate discussion, hopefully encourage change talk, and maybe discussion of discrepancies among their loved one with hoarding. And, I teach a lot of graduate students how to do therapy. And the one thing I learned, or the one thing that I notice every single year, is that grad students are absolutely surprised about how many closed-ended questions they naturally use in their everyday conversation. Closed-ended questions are, in a lot of ways, the default, especially in English and in our Western civilization. I think it is a really hard thing to start to buck that trend and to use more open-ended questions. So family members often really benefit from practicing this in family training. Let's practice some open-ended questioning. And then they start to learn, oh my gosh, I can't believe how many closed-ended questions I use. And so a lot of practice can be useful. The A in OR stands for affirmations. This is sort of positive statements about learning how to engage the individual with hoarding using positive statements, praise, things that can be energizing and motivating, not in a disingenuous way or in a manipulative way, but in a real way. If someone's putting in the effort, you can let them know how appreciative you are of how much effort they're putting into change. Or if they have a good point or they make a good comment, you can really let them know that. Or you can give them, some encouragement, like a bit like a cheerleader, about what they're doing. Those are the affirmation approaches to active listening. Reflective listening, again, for the professionals are going to be quite aware of this, but for family members, this may not be supernatural for them. As they talk to individuals, they might learn that they don't do a whole lot of reflective listening. Reflective listening is exactly what it sounds. You are taking what you're hearing and reflecting back a core element of it. I always err on the side of the emotional content because it's never going to be wrong to reflect and validate someone's emotional state. It can be problematic if you are reinforcing or validating or reflecting their cognitive components. So if someone says, I really need this later, you can reflect that, but I encourage people not to do that because you don't want to reinforce that belief. Instead, you can validate the idea that, okay, they want to save this because they're scared to get rid of it because they might need it later. You can validate the fear or the anxiety. Like, it's very scary to think you might need this and not have it. Versus you're right, you might need this later, right? So reflecting the content can be risky, but reflecting the emotional content is always okay. And so when in doubt, reflect emotion. And this is something that, I tell all of my grad students learning therapy, and I think you can teach it to family members too. Validate the emotion, validate the emotion, validate the emotion. You can never go wrong. Validate the content can be problematic, all right? Summary statements are very much like reflections, except for you're doing a little bit more consolidating everything you're hearing into a brief or concise summary statement. You can say to somebody, so what I'm hearing is that you're saving all of these magazines because you think that there's important information in them, and your intention is to read them all so that you can make sure that you're not getting rid of anything useful. That would be a summary statement. You can also plug in some of the emotional content too, if you really want to emphasize that. And you would be very ambivalent and anxious to get rid of any of this in case you're losing out on important information. So these are different components of ORs, and I think it's straightforward enough, but in theory, but hard to practice. So I like to integrate a lot of practice with family members into motivational interviewing training. Ambivalence, again, is a key concept to define, and change talk is important to define. Change talk is any statement that reflects a desire or a want to change or an ability to change. Anything that suggests that they're more aware of why it's good to change or not good to change. Insights into why their current situation is not great and why it leads to that discrepancy that we talked about earlier. Any willingness to commit to change or any steps that they've taken recently, those are all really good to highlight. All of this counts as change talk. Any signs of readiness to change are really critical to highlight, emphasize, reinforce, praise, you name it. Any decreased resistance. If someone is showing a little less resistance to change, a little less ambivalence, that is really critical to highlight and praise and really run with it. Decreased discussion of the problem may, in fact, if they're in the right stage of change, may mean that they're ready to move forward. Now, if they're in the pre-contemplation stage, decreased discussion of the problem can be a negative sign. It can mean that they're kind of over it, that they don't even want to talk about it. You've burnt them out. You've gone too far. Um, but if they're a little bit more towards contemplation or preparation in the stages of change model, decreased discussion of the problem is actually a good thing, because that means they might just be ready to go. Any sense of resolve, like if they're ready to do this, I feel like I can do this, any sense of self-efficacy or confidence, all really good. Any increase in their change talk, if you're hearing anything that suggests that they're ready to change or that they can understand why change is good, great sign. Any questions about change means they're curious about it, they're thinking about it, they're contemplating, or they're preparing. Any envisioning life after change is really critical. I think this is maybe, I'm hoping, where my virtual reality approach really wedged in it into the context. Can they actually see what their home would look like after this change? And that could be really inspiring. And then, of course, experimenting with change behavior. Are they doing little things here and there to move forward and prepare for change? Or are they trying to do little exercises on their own? That's always an encouraging sign, as long as they don't scare themselves away by trying to do too much at once. So sometimes we have to give them the praise that they want and then say, whoa, but let's do this at a slower pace. I'm really worried that you're gonna get discouraged. Let's see. Some ways of encouraging change talk and getting them to be more confident is to have your loved one with hoarding review any success stories. They might really need to dig in and think about things. Sometimes it doesn't become obvious right away, but there could be stories of how they cleaned out one box, or they had to make a move, even if it was 20 years ago and they were able to do it, or they cleaned out a public storage unit. You can kind of think about any prior success and have them recall that. Just even thinking about it and bringing it to your attention and giving you details can be in and of itself motivating and inspiring. You can discuss the strengths of the individual. Everybody's got strengths, right? And sometimes the individual with hoarding cannot recall them or come up with them. So you're gonna have to really help them see it. But common strengths among individuals with hoarding include creativity. It includes compassion for others, intelligence. Everyone has their own unique profile, but everyone has strengths. And it's very wise to try to integrate those into a discussion to help people feel motivated and confident. Also, what supports do they have, right? If they've got people who around them can help them, that's really encouraging. Not everyone has that. So can you leverage that, and can you remind the people that they have such supports? Brainstorming and problem solving can be a useful way of moving forward if the person's in the right mindset for that. And of course, people with hoarding have a ton of historical experiences with not being successful and what they would call failures. And I think it can be helpful to reframe those, right? And the very least, you can reframe it as, look, you probably didn't have the support or the right tools or the psychotherapy or behavioral treatment that you're getting now. You also just don't have the experience that you had previously. Maybe now you're ready, right? This is the kind of thing where you could reframe it instead of validating this idea that it's a failure and that somehow speaks to who they are as a human. We just define resistance. I think one of the most important things is that we talk about how normal it is. It's very normal. Everyone gets resistant, especially when someone comes up to them and gives them criticism or expects change or gives them feedback. It is a skill to take feedback and criticism and not get defensive and to actually accept it, let alone want it. So resistance is a really normal phenomenon, and resistance can be magnified if it's coming from someone who's doing it in a critical way or uses a lot of expressed emotion. So a lot of what we talk about is the normal components of resistance, and that it's not something to be surprised about, and it's not something to to consider a huge negative or to vilify the individual who's showing resistance, because it's all normal. In fact, the more you consider resistance to be a part of the picture, the more likely you are to be more flexible and fluid in how you engage your loved one with hoarding. And of course, we talk about reversing, which we talked about before. If there's a lot of resistance or the individual needs to back up in their motivational talk, they're not ready to engage in actual change, you might need to reverse and start doing some of the other strategies to just evoke change talk or to talk about the discrepancies and vision for the future. talk about ways of resisting to resistance, responding to resistance, resisting resistance, I guess, meta resistance, using simple and double-sided reflections, amplified reflections. These are ways of reflecting back to people to get them to continue talking rather than sort of trying to put a stop to what they're saying. And again, if you validate the emotions, it can kind of get them on your side, and it can be a collaborative discussion. A double-sided or an amplified reflection is interesting, right? Because it's a little bit like reverse psychology, where you reflect what they're saying, but you do it in just an exaggerated kind of way, so that they kind of take a step back and go, wait a second, that was a little too strong. Maybe it's not that strong. Maybe it's not that way. And then they start to argue the other side that you want them to argue. So an example of this might be someone says, why do I need to change my place so that people can come over to visit? And then you might say something to the fact, you don't really see the reason to change because you never need anyone to come over, right? And if someone hears that, they may be like, wait a second, no, that's not really what I mean. I would like people to come over to my place. It's not that I never want them to come over. So in a sense, you kind of over accentuate what you're saying, and then they start to back away from that, saying, wait a second. And then they start to argue for change. This is a tricky one. I often encourage people not to use this unless they're comfortable, because it can feel, if it comes out wrong, it can be patronizing and or manipulative. So be very careful. But there are a bunch of these strategies that you can learn and that we go through in FAM training. And I'm not going to go through all of them today, but it can be things as straightforward as reframing the problem to get them to see, to help them like restructure the way that they're thinking about the problem. It can be about emphasizing self-determination. Like, look, I'm not here to fight you. This is your choice. You get to choose how you live. This is not about what I think is right or wrong, right? And you can also talk about pacing. You can validate anger, and you can validate other emotions. So there are a lot of strategies for dealing with resistance. And we go over all of these with a family member. And all of these are discussed, and handouts are in the Family as Motivators training manual. The last module we go through is harm reduction. I'm going to go through this, and then I'll open up the floor for questions. Harm reduction is an approach, a perspective to working with individuals with hoarding from a professional standpoint and from a family member standpoint. Instead of approaching things from a values-based approach, that this is dirty or ugly or gross, no one should live like this, this is not okay, and being critical in that sense and approaching it from that way. Instead, it's much more palatable for individuals with hoarding, or at least most of them, to think about harm and reducing harm. This actually came out of the substance abuse research literature, where they were talking about giving out, for example, clean needles to people who are abusing heroin, because it's safer, fewer infections, HIV risk reduced considerably. So there was this idea of people are going to use, and we may not promote that, or we may not be okay with them using from a judgment standpoint, and we may be worried about it, but we know they're going to use, and let's make it safe for them. We can work on the motivation to change, but in the meantime, let's make sure that we're not having an explosion of HIV or infection or overdose. Let's actually give them ways of being safe. This was translated and sort of used. Michael Tompkins did a lot of this work to translate this to hoarding. And in my mind, it's been much more palatable for the people I've worked with. Instead of, hey, let's change your home because it's really cluttered and gross and no one should live like this. Instead, I'm really worried about the fact that you have no way of escaping if your house is on fire. I don't really need to get rid of all of your stuff. That's not what I'm here for. I'm really here to make sure that you don't die in a fire needlessly. Fire is one of the biggest reasons that people with hoarding die. It's a much higher risk than people without hoarding. So let's make sure that you're safe, right? Let's make sure you have a way to get out. Let's make sure that there's nothing combustible on top of something that generates a ton of heat or fire. Let's make sure that you don't have a high risk of infection because you have food or animals decaying in your home, or insects or rodents. So there are lots of ways of approaching safety when it comes to hoarding. Right? So we're not necessarily requiring people to stop their hoarding behavior. That's not the approach that you take, although that is often the side effect of getting people roped into a harm reduction approach, is that they start to see the value in just changing some of their behavior in general. So some of the principles of harm reduction are to do no harm, right? It's not necessary to stop all behaviors. It's about safety. It's about realizing that every situation is unique. No two hoarding situations are alike. Loved one is an essential member of the team, and to make sure you prioritize safety. A lot of this involves identifying harm potential. Tompkins and Hartle have some of this in their book called Digging Out for family members, and professionals have a manual that he has published as well that can be really useful. And there's a giant list of potential harm that can come from hoarding situations. And it's really useful just to go in and even check off some of the things that you're seeing as a clinician or a family member. So you can do this assessment. It's about using the skills we've talked about today: non-judgmental, open-ended questions, evoking change talk as you're going through and seeing the harm potential, and using that harm reduction approach as you're thinking about what's going on in their loved one's home. Right. Things to consider are level of support. How much support does the individual have? If you as a family member live states away, you may not be there to help them declutter or to make sure there's no harm. Do they have anyone around them? Versus someone who's living in the home with the loved one with hoarding, those are two very different support situations. How much insight, how much motivation does the individual with hoarding have? If the person has tremendous insight and a ton of motivation, that's a different level than somebody who is the opposite. So you need to factor that into harm potential, right? And what other factors do they have that are comorbid or complicated? Do they have medical conditions? Do they have severe asthma? Do they have potential for broken hip if they fall and trip on their clutter? These are the kinds of things you want to think about. Do they have open wounds, which can be infected very easily? Do they have alcohol or drug problems, which can lead to things like fires if someone smokes cigarettes, for example, or if they're drinking too heavily and they're easy to trip or fall? And what other mental health issues might they have? Oftentimes hoarding is comorbid with all sorts of conditions, from anxiety disorders to attention deficit hyperactivity disorders, psychotic spectrum disorders. How can that get weighed into harm potential? Right? And what categories do these fall into? And this is more for just kind of thinking about the different types of harm: safety, health, comfort, right? Sensory limitations, financial harm, right? If they don't have a system for paying their bills, they might be in tremendous financial straits. This is really common. Can't tell you how many times we've done work with individuals with hoarding and found checks for tens of thousands of dollars that they intended to cash that are 10 years old sitting in somebody's clutter. Finances can be dramatically impacted by hoarding, right? So how much financial harm is coming is something to think about. I tend to prefer something called the Uniform Inspection Checklist. Marnie Matthews created this in 2014. It's posted on the internet. You can Google it. And it's every jurisdiction has their own rules about what is and isn't okay for an inspection, to pass an inspection. So for whatever jurisdiction your loved one is in or that you work in as a professional, you might want to become aware of what those are. In the meantime, the Uniform Inspection Checklist was created as a general set of common requirements to pass an inspection. As you can see here, they're broken into different targets, and it's about a page long and it has different things, from how big are the egresses to are the windows unobstructed, are there smoke detectors, CO2 detectors. Harm reduction often can be just going down this list and making sure that they can meet all of these, regardless of the clutter. So if you can move the clutter around to make sure that they're safe, that's a first step. Oftentimes it leads to decluttering and hoarding improvement. But at the very least, a harm reduction approach is much more palatable, because if somebody can meet most of these, legally, it can be much harder for someone to get evicted and for there to be disruption in the individual's life. And so finally, the last session is that there's a harm reduction plan. I was going to show you a harm reduction contract. This can be, I don't know that there's time to do that, but it's in the manual should you want it, where you create very specific goals, things that are doable and prioritized. And you have rewards built in for individuals with hoarding to earn if they can make things, if they can work on making things safer. And you can also do this with a family accommodation contract as well. And you can give out do's and don'ts handout for how to handle harm reduction. And I think I'm going to end there and open it up for questions. There's my information. Again, it's on the handouts. You're welcome to email me if you'd like the manual. And I'm going to stop share. Fran, how did you want to do questions again?
They're all in the question and answer panel. If you
Okay.
want to look there, I can read them out if you want, or you can just read them yourself. Up to you.
Okay, yeah, I see. All right, so one-to-one FAM training, is it billable through insurance? I have only done it through research, so I've always actually paid people to come and do it. I'm sure that that's not sustainable from a real life perspective. I know that other people out there are charging for it in a group format. I don't know if it's billable. That would be a very good question in terms of reading the contract that you sign with your insurance company very carefully. I don't know that it's not really psychotherapy. It's more of an educational group for a family member. Whether or not you can bill it as meeting with a family member of an individual with hoarding and counting that as a family member session is something I'm not aware of. So I wish I could answer that question definitively, but I really think it comes down to the insurance contracts and how you've set up the actual program. Let's see. I guess it goes in reverse order. Let me go down here. Wait, no, it doesn't. My husband and I have divided the house so I have clear space, and he has 2 rooms to clutter. Yeah, this is really common. Married for 20 years. Really common to sort of work on having designated space for a loved one with hoarding. Does it work? Is it good? Is really a question that I can't answer because I don't know enough about the context. But if your marriage is doing okay, it's functional, it's not causing distress or impairment, it's not causing dysfunction, then I would say that it's clearly error. It's definitely leaning more towards being okay than not being okay. As soon as it's starting to cause marital issues or other interpersonal distress, or if it's causing impairment in functioning at work or home environment or in any of those things, then I would say it's starting to become a problem and requires some attention. Let's see. Do you feel that the facilitator of your program should be a professional, or could it be done by a layperson? Like a task force member or a non-mental health professional. Typically, I've given out my manual to professionals only, but I know people have expanded it to be used by professional organizers who are also professional but not mental health professionals. I know that there have been some people thinking about translating it for emergency responders and organizations. I don't see why it can't be used by non-professionals. It's not meant to be psychotherapy. It's meant to help give people some tools to educate people. I'm not really sure that it would only be okay for professionals to give, but it might be worth, that is a question that's still open for exploration. Do I think hoarding has similarities to addictions? Absolutely. There's a high level of impulsivity in both. There's also a lot of comorbidity between certain types of addictions, including behavioral addictions and hoarding. Do I think that, let's see, a lot of parallels with avoidance behavior, as well as a lot of the treatments are very similar. Like we talked about, motivational interviewing is really key for both. Harm reduction is key for both. Are there major differences between the two? Absolutely. I could probably give an entire talk on the overlap and non-overlap between hoarding and addictions. So it's a good question. I just unfortunately don't have a ton of time to go over it. What would you say are the most clear and most obvious, and what would you say, the most common ways that family members do enable a family member? Changing their routine is really common. We talked about that. Being willing to be late for things, being willing to skip certain activities at a person's home, willing to accept belongings, putting up with relatively bizarre or problematic behaviors, paying for extra things, allowing the individual to run up a debt, storing things at people's homes, allowing them to store it at your house. These are common ones, I would say. Good links or resources to learn about the concept of discrepancies. Anything that's motivational interviewing is going to have a lengthy discussion about discrepancies as a construct. I would say anything by Miller and Rolnick, Rosengren. Just Googling motivational interviewing or doing a research literature search on it can be really helpful to get a sense of discrepancies and how they play a role in motivation. Let's see, I have about a minute. There's a lot of questions. Let's see. Good question about virtual reality. Right now, it's at its infant stage. I can't give you specific details about how to implement virtual reality for motivation. I'm happy to talk to you more. If you shoot me an email, we can talk more about it. But as of right now, it's really in the academic setting. I don't have a whole lot of information about implementing it in the real world just yet. Unfortunately, NIH just said no to a grant I submitted to do some work on this. I don't really think NIH is always has hoarding at the top of their list of priorities, which is really unfortunate. Let's see. Examples of evoking from the 3 components of motivational interviewing. Anything you can say or do that would evoke change talk. This can be talking about the discrepancy, having them think about where they want their life to be, thinking about what they want their life to mean. When someone goes up and gives a eulogy about them at their own funeral, what would they want them to say about them? This person had the most cluttered environment of any human on the planet, or would it be this individual was able to accomplish X, Y, and Z? Here's what they were, here's their values. Help them see what they want to be in the future and what they want their life to be about can be part of evoking. Ooh, a lot of questions. I don't believe I have any more time. I am happy. We're out of time, as Fran said. What I would be happy to do is answer these questions offline. Maybe, Fran, I don't know if there's a mechanism for providing people with my answers. Is that something doable?
Yeah, I guess it's up to you. If you want to give your email address again, we can do that and just have people email them to you. That's probably the best way.
Yeah, if people have burning questions, I'm happy to answer them. Let me put my information up again, and then I will say adios. It's right there for you, gchazen@gmail.com. Shoot me an email. I'm happy to send you any information you might have. I'm sorry I didn't leave more time for questions. I hope this was educational and informative for you. Feel free to reach out if you want the manual. Thank you for your interest.
Thank you, Greg. Thanks, everyone. We're going to do a 15-minute break, and next session will start after that. Thank you.
No problem.